So there are a lot of things that we're able to do in the office that 5 or 10 years ago we just weren't doing, and we're requiring patients to undergo general anesthesia in the operating room. I've been in practice over 10 or 12 years now, and turbinate reduction has been done in the office since I've been in practice. Turbinate reduction is a procedure that we do to help patients breathe through their nose, and basically makes the turbinates, which are the organs of our nose that humidify air, makes them a little smaller. The same thing that when you take a decongestant, right? You take a Afrin or a 4-way spray or neosynephrine. That drug is basically making the turbinate temporarily smaller by chemically shrinking it. So the procedure turbinate reduction that we do in the office is doing the same thing, but doing it mechanically instead of chemically. And that's about a 15-minute procedure, and believe it or not, it doesn't hurt afterwards. Patients really like to breathe through their nose. They like having their turbinates reduced when it's appropriate. The next thing that we're doing in the office is we're doing a lot of sinus procedures now in the office that we weren't doing before. One of the probably the newer well-advertised procedures called balloon sinuplasty. We use a tool, a balloon, okay, like this. And this is one company, Entellus' product. There's another company that makes a different version of a balloon. But it's just what it sounds like. It's a balloon that we can place across specific pathways in the sinus. And then literally just, you inflate the balloon, and when we inflate it, it opens up that pathway, right? And then we deflate it, and then we, take the balloon out, okay? So it's not something that stays inside. And the nice thing about a dilation procedure is it can be done in about 30 to 40 minutes in the office. Most of my patients don't take any sedatives beforehand. They just walk on in, like a dental procedure, get your tooth filled. You just come in, they numb you up, and then do the procedure, and you go home. Then you have a little achiness the first night. Next day you're back to most of your regular activities. And then we've kind of advanced that beyond just dilation, and now we're doing what we call hybrid sinus surgery. So hybrid is where we use some tools like a balloon that are dilation type treatments, and then we combine those with more traditional sinus procedures where we actually take little partitions down in the sinus, but in the office. So I've done over 150 hybrid sinus type procedures in my office. So very effective. Patients tolerate really well, and it saves a lot of cost on facility fees, anesthesia fees. And the third thing that we can do in the office is actually we can do a lot of septoplasty in the office. So not many surgeons are doing that. I do offer septoplasty in the office. It's the same exact procedure you would have done in the operating room. It's just done in the office. It takes 15 or 20 minutes. We usually combine that. Usually we're doing septoplasty with turbinate reduction or septoplasty with sinus procedure. Sometimes we have to do a septoplasty, which is a procedure to make the septum of your nose straighter. Because the patient needs a sinus procedure, and because the septum's bent, it's in the way of the sinus, we do the septum just to get access. So turbinate reduction, sinus procedure, septoplasty, all done in the office, takes about 45 minutes, and honestly saves a lot of money and anxiety for patients so they don't have to go to the operating room.